needed to treat Lindane. So we're going to start with treating neurotoxicity. The best way to treat neurotoxicity, which would present as seizures, is with a sedative for the system called diazepam. This is a benzodiazepine. It works on the neurons to really calm them down and to ensure that the membranes are stabilised. When somebody's having a seizure, they're not stabilised anymore. So this really makes sure that the electrolytes are in the right place and the membrane is nice and stabilised and electrical signals can conduct as normal. Then we want to treat the cardiovascular system. Normally we would use a beta blocker, but we can't use a beta blocker in this case as it would be negative on the lungs, and Lindane is already doing that and we don't want to make that worse. So we'd use digoxin. This is a cardiac glycoside. It stabilises the heart cells. It really helps them contract fiercely and helps interfere them unneeded impulses from the too much acetylcholine that's in the body. We'd also need to monitor a patient on an ECG, this is an electrocardiogram, for 6 to 8 hours just to ensure they're not having any heart attacks, because we wouldn't want that to happen now, would we? Then we're going to move on to the respiratory system. This is treating bronchospasm. So this is when the airways get tight and they constrict, and it makes it feel like you're having a really big asthma attack. And this is because when there's a lot of acetylcholine in the body, it agitates the lungs and it sets off the respiratory system to contract, and we don't want that, so we've got to reverse it by using a short-acting muscarinic antagonist. This will act on something called muscarinic 3 receptors. They're found in the airways, and when we activate these, we will cause the relaxation of the smooth muscle in the airways, and this allows the airways to open back up again and you can take a nice big deep breath. But we'd also want to pair that with some oxygen just to ensure that there's enough oxygen going around the body and nobody is suffering from hypoxia or low SpO2 levels. Also, with persistent seizures, sometimes patients can struggle to maintain their own airways. We would just want to ensure that them airways are safe and do an endotracheal intubation. This is a tube that goes down your throat to keep the airways nice and open. So guys, the main reason these issues have occurred is because of acetylcholine. We really need to target these three systems as they're the highest likely, they're the systems that are going to cause morbidity or mortality, and they are the main systems affected by Lindane. If you have any issues or any questions, there's our references, and feel free to contact us on the Contact the Team box on our Meet the Team website page. Thank you.